So what are some of the important considerations when it comes to choosing a best family planning method for your health or a different family planning method for your wife? Of course, as a husband, as a caring man, you should be taking responsibility when it comes to a family planning method for your wife, because at the end of the day, it may affect both of you. So in this video, I want us to look at very important things, like what you have to have as a priority when it comes to choosing a family planning method. I understand people choose family planning method depending on what has worked for a friend. For example, you ask your friend, what family planning are you on? And somebody tells you, I'm using Depo. Is it working for you? Yes. And then from then you just go take Depo and it's going, or you get a lot of bad side effects from them simply because you didn't have this awareness I am going to share with you. So before you do any other thing, just sit down, put your phone near, and listen attentively, because this is something that affects almost every other woman. Hey, you are welcome to the Health Awareness channel with Dr. Kalenzi, and on this channel we learn about our health. We learn to appreciate different conditions that affect our body, how they can be prevented, how to identify red flags, and how we can prevent our bodies from having long-term complications, because prevention is better than cure. And number one, health status of an individual. For example, you need to ask yourself before you make a choice for any family planning, do I have high blood pressure? Am I a person who has clotting disorders? Do I have diabetes? What is my current weight? Because all these would probably be worsened by the kind of family planning method that you're going to choose. Oh, actually, they would also make the family planning method you have chosen less effective. For example, having high blood pressure and you are on contraceptive pills could worsen your blood pressure. Why? Because it causes your blood vessels to narrow down, as well as making them stiff, which makes your blood pressure control difficult, especially when you go on the family planning method when you already have high blood pressure. Number two, weight gain. Family planning method like Depo-Provera has been confirmed by studies that actually women who are on that family planning method, within 1 year of being on that family planning method, you could actually gain 1 to 5 kilograms, and those are very many. You find somebody who just started family planning just a year ago when they are 23. After 2 years, you look like a 35-year-old. So these are very important considerations when it comes to choosing family planning method for your health. Number two, let's talk about side effects. I want you to appreciate that every family planning method has got its side effects. But the most important thing, are you able to bear? So this is what you have to understand, that every family planning method has got its side effects, ranging from weight gain, mood changes, heavy menstrual cycle, reduced libido, and vaginal dryness, but amongst other side effects. Therefore, before you choose any family planning method, ask yourself if you would bear having heavy weight. Ask yourself, probably, if you're a person who bleeds so much and now you're choosing like copper T, IUD, would you bear the chronic long-term effects? I'm not saying that that's the effects happen to every woman, no. But if you are a person who bleeds so much and you're choosing such kind of a family planning method, then it would not be the best choice for you. If you are a woman who has reduced libido and now you are going on a family planning method which would worsen your libido, then it's not a good option. What I'm saying is that it's important, sit with your midwife. Tell her your considerations, tell her your worries, tell her, talk about this discussion rather than hearing a family planning which works for a friend and you make it your option. The third thing you have to consider, reversibility. You would want to know the kind of family planning method I am choosing. Is it reversible? For example, if you're a candidate who still needs more children, then a family planning method like bilateral tube ligation, like removing uterus, a hysterectomy wouldn't be an option for you. You get? And so reversibility of a family planning method is a very important thing when it comes to choosing a best family planning method for you. The fourth thing is desire for children. This is an important thing because you might have given birth when you are so young, say 16 years of age, and you want to have more time. You want to have more time to have children. That means you would want to consider a family planning method which could take you like 10 years, of which IUCD could be a better option. Therefore, or you are a person who wants children within 1 year from your previous birth. So having a family planning method that could stay longer in blood and cause a lot of hormonal changes before you get the second conception would not be a good choice. So that's very important to think about if you need children in future. Like, it's very important, because if you need children shorter in future, then you would get a family planning method that could easily be reversed. Or you need a family planning method that when you stop, you could actually easily conceive. I actually also have some examples. For example, if you're a woman of like 4 previous scars, you are a person like 4 previous scars, I mean, like you have had all your previous children, you have delivered them by Caesar, you were operated. So if you are operated 4 times in the past, we say you are a 4 previous scars. Therefore, we would want you to have a family planning method that could take you longer for some time, so that you go through a healing process, so that your body restores and prepares itself for the next delivery. Because you know that if you have a conception sooner from the previous scar, you could actually get an early rupture, or actually have a lot of issues and a lot of pain in the coming pregnancy. So number 5, and very important thing, is protection against sexually transmitted diseases. We understand very well that some family planning method would not protect you from sexually transmitted diseases when used them alone, and some can actually protect you from having sexually transmitted diseases, as well as preventing you from having unwanted pregnancies. Therefore, if you are a person who has query multiple sex partners and you're not sure how the status of those people, you should be a person who considers, one, using 2 family planning methods at the same time, or actually having a family planning method that could prevent you from having unwanted pregnancy, but as well as protect you from having sexually transmitted diseases like gonorrhea, like HIV, like syphilis, among others. And now this brings me to another point that is actually very important, which is called support from the partner. So some family planning method could actually be effective if your partner was very supportive. For example, if you choose to use a condom, it's not about you alone. Your partner must be actually very willing and into it for this kind of family planning to work for you. Another thing, using contraceptive pills, because these pills you have to take them every day, and you would actually be at a better advantage if your partner would be a kind who reminds you to take your pills. Otherwise, sometimes you may forget, and then this risks you from having unwanted pregnancies. So if you're a breastfeeding mother, especially someone who just gave birth, there are some family planning methods that couldn't be the best choice for you. And the reason is some of them could actually reduce your breast milk. So choosing family planning method like combined oral contraceptive pills right after birth is not the best choice for you when you just gave birth. And research says about 6 weeks and more, probably you could use or make them as a choice, but not immediately after birth. Number 8, conveniency. Some people want things they can do at their ease. So if you want family planning method that is very convenient, that would give you peace, that you want, that you can hide when you want, that nobody will ever notice that you have, then it's oral contraceptive pills. Because then you won't need a midwife to insert it if it is like for the IUD. Then you won't have to have pain inflicted on you when they are inserting, for example, the implant. So conveniency is very important when it comes to a method of family planning that you need, and discussing with your midwife about your desires is so important. So privacy, that is a very important thing. Some people want actually their family planning to be as private as possible so that none can actually ever notice that they have some family planning method. So discuss with your midwife and find out what is best for you. The important take-home message is that before you choose any family planning method, ensure that you discuss with your midwife first of all, so that you tell her your worries, tell her some of the special things or some of the health conditions that you could be going through, and then weigh your weight. It is important. Take your weight, make sure you do your blood pressures, make sure you check your sugars, and then if you know that you're a person who bleeds so much, or you previously had a heavy blood loss following, say, an abortion, following childbirth, make sure that you do a complete blood count and you know how much blood levels you have. All these are going to help you to know which kind of the family planning method you can choose. And then also ensure that you think through your family history. If you know that you have had any family member who has ever suffered from a breast cancer, I mean, mention said things, because some of the family planning methods could actually predispose you or increase your risk of developing like breast cancer. So it's very, very important to have these considerations looked into before choosing any family planning method. Thank you so much, everyone that took their time to watch this video, and I'm sure you have been blessed by this video. Share with a friend. Do not forget to subscribe. Until next time, thank you.